When we're looking at starting a patient on Aviclear for their acne and getting control of that, I would imagine that, like any full facial treatment, this will be somewhat regenerative anyway because of the heat production, because of the energy. The whole concept of photorejuvenation is built around that sort of concept. I can't see this being any different as far as regenerating tissue. So I would expect some improvement overall in the texture and the quality of the skin being treated, aside from the acne being treated. But probably more than this, it opens up a journey with the other machines in the suite, where you might have erythematous red acne scarring and marking, which would be a really good technology for either the XLV Coolview or the Laser Genesis to target. Equally, the hyperpigmented acne scarring that sometimes you get would be a very nice option for things like Limelight, and even the XLV again and Laser Genesis again. So the whole ability of the suites to suite products to actually add energy into the tissue in different ways using different chromophores is really a very, very useful thing. Acne scarring obviously is a multi-modality event, and lasers and energy-based devices are only part of that, but they form a very important part of it, especially if you can catch things early. For example, and again we're taking it the other side, but isotretinoin has always been a very good technology, but often during the isotretinoin journey there is a phase of erythematous red acne lesions that are kind of post-inflammatory but not quite settled yet, that we've always ignored, and we've waited for things to settle, and then when we're off isotretinoin, then we've gone and done treatments. We now know that it's relatively safe to use treatments while people are on isotretinoin, and so you can actually combine isotretinoin with even this technology, the Aviclear, or else certainly you can combine it with the XLV, with the Limelight, with Laser Genesis, to combat that red, what's called angiogenic phase of wound healing, shortening that and decreasing its likelihood to go on to scarring. So I think there's a lot of things to be worked out introducing this technology, but it certainly has a place within your broad sweep of products.